10 minutes, and 5 minutes of talking, 5 minutes of questions. Some people suggest I can't do anything in 5 minutes, but we'll find out. I am Bill Betten. I'm the VP of Business Solutions for a company called LogicPD. That'll be coming up shortly. I'm not going to spend a lot of time talking about that. After many years of product development, including a lot of things in the medical space, for other companies, I joined Logic to help other companies develop products, and that's basically what we do. I've touched just about everything in medical, health, fitness, that sort of thing, except things implanted, although today I was meeting with people about artificial hearts, so I may cross that threshold as well. I was asked to put together a quick talk on contrasting consumer device development and medical device development. I've lived in both worlds. Many of you probably have as well, so hopefully I'll spur some thoughts and conversation. I'll hand out cards, I'll stick around, and I'm always happy to chat about this afterwards. So, no further ado, go ahead. Okay. Who's LogicPD? LogicPD, the other part of it, we've been around for over 50 years here in the Twin Cities. We have over 450 people, 100 engineers. We work to help people implement, develop products, and realize their dreams. I run the life sciences and medical practice. The fun part of that is we go all the way from Fitbit, fuel bands kinds of things, all the way through veterinary science up to and including regulated class 2 and 3 medical devices. So I get to see the gamut of the consumer side in medical and health and wellness and fitness, all the way up to the regulated space. Next slide. I like this slide a lot. It came from IBM, and I've been using it for half a dozen years when I talk about this sort of thing, because it really contrasts and starts to show what's happening in today's environment. On the left, you have the consumer electronics companies who are coming. You see Apple, Samsung, all of those people selling watches. You could argue, are those medical devices or not? I'll touch on that in just a moment. On the right-hand side, you have the companies that many of us know here in the Twin Cities. Medtronic, Boston Sci, et cetera, the regulated. So consider the line on the right, that's where the FDA steps in and regulates things. But in the middle, and this is the fun part about it, there's a battleground for adopters. It's the great unwashed area with a lot of unmet needs in health, wellness, fitness, that sort of thing. And there's a battle. Both sides are moving towards one another. And what I want to do tonight is give you a brief example of what the contrasts and differences are in product development in those spaces, talk a little bit about the regulatory impact that happens, and leave you with some thoughts if you're thinking of moving into one space or the other from the others. Go ahead, please. So first, just a quick definition. I apologize if you're living in the medical space world, and I'm going to go through this really quickly. It's basically the FDA regulates it. It's an instrument, apparatus, implementer machine that's basically intended for use in diagnosing or treating disease. Very simply, that's what it means. And it's really all about the intended use. I have a client who came to us and said, we're going to build this thing to monitor this condition, and we're going to take it to this country, but we're not going to have it be a medical device. Great. We're going to have it be a consumer device. What do you intend to do with it? It all boils down to that, because if it quacks like a duck and walks like a duck, maybe it's a duck, and you have to deal with those regulatory issues. So it's all in how you position the product and what you're going to do with it. Next slide. So what are the two biggest trends that are driving the convergence in this space? It's two things primarily. There's a lot of subtext and categories under this. It's really the growth of technology and acceptance in new applications. We're all living with a variety of smartphones and various devices and watches and things that start to monitor us. We had a client ask us to build a demonstration product watch that had a heart rate monitor, it had pulse ox, it had an accelerometer, it had NFC, Bluetooth, had all these neat gee-whizzy things in it because they wanted to show what they could do and potentially help monitor people's health and wellness. So we're all getting used. We've made the move in the evolution from the old dumb cell phone on the left to the smartphone on the right. There's still, and then the aging population and chronic disease increase is a huge factor that's going on as well. I won't bore you with the numbers, but basically we're developing chronic diseases earlier for a variety of reasons, not the least of which is our diet, our sedentary lifestyle, and those sorts of things. And we're living with those chronic diseases a lot longer. People, in the 30s would die of diabetes. Today you can live with it, manage it, and deal with that disease. So those two things are really driving the convergence of technologies. Next slide. Okay, this stuff I want to dwell on a little bit because this gets to the heart of the talk that I was asked to put together. I'm really here contrasting the various attributes in product development between consumer devices, and I mean purely consumer devices moving through about halfway of that hump chart that I showed you, and med devices to the right of the FDA. Time to market in consumer devices, we all know what that is. It's rapid. They pop up, they go, you got a new evolution, you're changing in a year or 18 months. Medical devices, and I'm being very conservative here, it's slow development. It's 3 to 5 years if you don't have to go back and reinvent something and go through a PMA process and go through that kind of development. Product longevity, in 2 years, if you're still wearing what you had and if you got the same cell phone, then basically it's an old phone. In medical devices, when we're designing and building devices, I worry far more about the ability to have a stable supply chain of chips for the next 7 to 15 years than I ever worry about using the latest, greatest, and best. And I don't worry much about price in the medical world when I'm doing that. So stability and longevity of supply and support is incredibly important. Hardware, latest, greatest, available and stable. Software, consumer devices, let's all go open source, everybody will contribute, we'll build a better package. I can't do that in medical devices. Talk about using group-oriented software development is a real problem because I need traceability, accountability, I need to know where that code's been, I need to know what it's going to do. User interfaces, simple versus specialized. Price, we all know about medical devices. If I price something as a medical device, it can be hundreds or thousands of dollars as opposed to something which has very much the same components. I work for a pulse ox company here in town running their engineering group. Our professional state-of-the-art Bluetooth pulse ox was $400. The same thing that had the same guts inside did not have Bluetooth, but we sold it in the consumer space for under $100. Makes a difference when you're worrying about liability and all those sorts of issues, but the hardware is the same. Reliability, of course, you'll throw your cell phone away if it quits working. You can't do that with a pacemaker. Next slide. Regulatory, I've got a slide that touches on this just a bit. I'm not a regulatory expert and I don't intend to go into it, but if you're doing medical product development, it's a fact of life that you have to live with. Information security, moderate in consumer devices, and it's amazing what you're willing to give away if there's a perceived value associated with giving your information away. Our previous speaker did a great job. Sign away your liability, that protects them. In the medical world, you have a tougher time doing that. I have to worry not the least about HIPAA and protecting who I am and tying that to my medical information. Now I have to worry about hacking my device. The infamous case of the diabetic patient who hacked his insulin pump. Very real story, could be done. Medical companies are now far more worried about security than they have been traditionally. Volume, millions to hundreds of millions is what's interesting in the consumer world. Thousands to a million. I think there are 2.9 million hearing aids sold in the US, and that's a high volume product. In most medical devices, you're selling tens of thousands or a few thousand or something along those lines. Efficacy, you can sell a product that's a consumer product, make a claim for it, put it out there, and buyer beware. Obviously, in the medical world, you're going through clinical trials that could take you years and can cost you $50 million depending on what you're going to do. So when you get a medical product, at the very least, you could probably count on it having been tested. And I put probably in there because we've all seen cases where things are used off-label or used in ways that they're not meant to be used. Interoperability, common in consumer devices. It's been limited in medical, but that's changing. The DICOM standard in the 90s came out tying medical imaging devices together. Today you have the Continua organization, which has existed and worked with the IEEE to define standards that get things like pulse oxes and weight scales and blood pressure cuffs to talk to one another. In the middle, in the hospitals, there's still some interoperability issues meant to be dealt with. And in IP, this is a fun one. In consumer devices, it's aggressive. In the medical world, you see far fewer patent battles except in pharmacy. I'll take that and set that aside. But medical devices have an interesting dilemma. In IP, you're supposed to be talking about new, latest, greatest, it's novel. Yet when you go to submit to the FDA and you write your description, it's new and neat and novel, except it's just like the one I did just before because I need your approval. So there's an interesting dilemma and difference between the two. Next slide. And I apologize for talking so fast. We're not going to go through this, but what I wanted to show with this one slide is if I'm doing a safety and performance requirements, the specs on the left are pretty much a lot of the standards and things I have to go and look at. As soon as I put the word medical in there and start to do that, I roughly double the number of standards and specifications that apply to my product. And I've done this for other things as well. So you can roughly say my impact on doing my testing and my performance measurement outside of the clinicals is at least roughly doubled. Not only taking more money, but taking more time. And I just wanted to show you that there's an incredible difference in rigor applied to the two. Next slide, please. Almost done. Maybe done. Is that my last one?
The last one.
I don't think it was, but that's fine if it is.
Okay.
All right. Anyway, I've got a couple minutes left for questions. I'm happy to field questions, comments, arguments. I'll leave some cards here, and I'll stick around to the end and happy to have this discussion as well.
So my question is a little more hypothetical, but I really like your slides showing the difference between medical and non-medical devices. How much of those differences do you think stem from the approval process, and how would that change the ballgame? Because I feel like a lot of the medical devices that finally get to when they can be used are almost outdated compared to research technology that we would use in the lab.
By the time a device gets to, and having lived in that world for a while in various areas, by the time a design team puts it together to the time it comes out can be many years. In fact, oftentimes the designers aren't even there. They're certainly off on something else because the product has moved forward and gone on. So I think that, yeah, by the time medical devices come out, I mean, today I was talking to a client who wants to launch a product in 3 years, but they're worried about support for 15. So we're having a debate and discussion about the chips that are going to be available to go into the product in 2 years, but are they still going to be around in 15? Not that you can't design those out. So yeah, there's a big gap. And it's driven by regulatory. You change a part, at the very least you have to document a file that says, hey, I changed this part. Change a processor and change something that could impact the calculation algorithm, slows it down even more. There's really, now to your other part, which is R&D lab. There's a lot of fun stuff going on in R&D centers. 2 weeks ago I was at University of California, San Diego in their wearable center at a summit meeting on all the new stuff, and you're talking flexible band-aids and EEG sensors that you don't have to, that are dry sensors and no more gel and all of that. It's really cool stuff, but it's many years away from ever making it into production. Over here.
So in that nature, kind of in that vein, associated with IoT being the new trends, what do you see with Bluetooth being kind of the next devices for medical, and what are the trends, and also what are the barriers in terms, I assume that the regulations for research behind Bluetooth are, are not quite there yet.
In an ideal world, most medical manufacturers would say, I really don't want to use consumer technology, but starting, I don't know, 8 years ago or so, particularly when Continua was formed, they said we're going to build off consumer technology because there's too much of it there. So it's so Bluetooth LE. Company I worked for did the first Bluetooth connected, Continua approved medical device. It was a pulse oximeter. So Bluetooth is being used in medical devices. You can get a weight scale that has a health profile that goes with it. So Bluetooth is an accepted technology that we're building into more and more products. On the other hand, it's still slow to adopt. We built a product that took Bluetooth LE from a smartphone to an intermediate device and took it to a 900 megahertz transmitter that talked to 2 hearing aids. Because hearing aids don't naturally speak Bluetooth, starting to change a bit, but there's power constraints, there's all sorts of issues that you get into. So consumer wireless technology is impacting medical devices very clearly. 15 years ago I did a lot in hospitals and imaging. Connecting the hospital network was almost impossible, and they didn't want to allow it. Today you walk in, you've got Wi-Fi networks, you don't have to shut off your cell phone anymore, so it's becoming ubiquitous. They're being forced to, except in certain instances, they're starting to use commercial technology. I know the one slide that was missing is a chart that said who's going to win, because I'm asked that question when I talk about this sort of thing. And I go through the attributes of why it might be medical or it might be consumer. I personally believe that the consumer space moves so quickly and is changing, and you're seeing it in the app world. Wireless apps. There are 113 apps that have been approved by the FDA for use in medical. Out of the 30,000 that are labeled health, wellness, and fitness, there's 113, if I remember the number, as of 2014 that have been cleared. So there's a lot of stuff called health, wellness, fitness, and medical, but we are using commercial technology. We're going to have to, almost everybody we talk to today, all the devices are connected and they're generally using consumer-oriented technology. Sorry, long-winded answer. Over here.
Just this, the first slide that you had with the image where you have got this battleground.
Yes.
And in that battleground, you have the medical device and all those companies and the consumer companies. How do you see the difference between, on the focus on design that is coming from the consumer side, where whatever you're developing, whatever you're marketing, the design has got an important aspect of that, compared to the medical devices, where design, from the user perspective or the consumer perspective, it's not really a consideration.
It's changing. I mean, in the old days, you're right, and one of the charts talks about the fact that the user interfaces used to be specialized. In the old days, the devices that you used were used by doctors, nurses, trained people to go and do that. Today, one of the things we lead with in almost every project is industrial design, user interface, putting people into those environments, look how they're using it, and doing that. I remember a device I built at a company that was a monitor meant to be used in an operating theater. Guys designed it, it was beautiful, it was neat, had a nice color touch screen, took it in, put it in. Guess what? In an operating theater, they have these big bright lights. And the first thing they said is, can you guys devise a stand that will tilt it down for us so that we can kind of see it? Because it was like looking at your iPad outside, and so it was a great design, but we didn't pay attention to the user environment. In most cases, that's starting to change, even to the extent of products that people don't like. The cardiovascular companies here in town, great pacemakers, they all battle, they have great products, keeps people alive. They all look at their controllers and programmers as a necessary evil. They all hate to do them, they have to do them, but they're starting to pay attention because now home users have to use them, technicians have to use them, the doctors have to use them. So we see a huge impact on, particularly as we take technology home with us, there's a huge impact on user interfaces and how they're going to use. So that's one of the areas where the consumer, where the consumer companies are going to win, just because they're taking that into account. You got to cut me off.
One more question. One more quick question.
Over there, he's had his hand up. Yeah.
My name's Tim Anderson. I'm with a company called Cancer Detecting Clothing, and I might be hiring you. We have a medical device. Our product is wearable technology that scans the human body for cancer.
Yes.
We see it as a consumer product, but it does a medical job. So we're going to be right in between these two spaces, trying to get FDA approval and have something you take out of your closet, put it on at home, you open an app, scan yourself for cancer, make your copy's done, you finish it, you take it off.
Right.
What type of regulatory landmines am I going to run into?
A lot, because as soon as you make a claim that says I'm going to detect cancer and I'm going to be used for the diagnosis, the FDA is going to step up and say prove it. And so you have to be very careful. We're back to that intended use. If you intend to diagnose cancer, that's a big deal. Now, if you and we work with wearable companies. We had an ECG shirt and things like that we did in Germany with some people. So it all boils down to what you intend to do with it. And if you intend to claim that you're going to diagnose cancer in a wearable device, you're going to have to go prove it. And if it works, that's great, but it's going to be many millions of dollars and a good challenge. But that's what it boils down to. Wearable technology is really cool, and it's going to be fun, but you're going to see it first in health, wellness. You're going to see it in professional athletes. We get a lot of requests to build sensors into shirts and clothing, and we're all probably wearing things that are monitoring as we do this. But if you and it'll work great in those markets. As soon as you cross the line into diagnosis or treatment, it becomes a medical device, and then you'll get interesting chats with the FDA. I'm sorry, I guess he's going to pull me off.
Yeah,
I'll hang around and answer questions later.
Okay, thank you.